Well, in our first section, we talked to David Ashford, the Minister for Health and Social Care, a general item about proceedings, what's gone on, the timeline. I have taken lots of questions, Dave, as you know, over the week. We couldn't do Monday. Tuesday, obviously, things completely changed. Here we are now, getting things in the afternoon sorted out. I'm going to do this actually in probably the newest to oldest because things have changed so much. So stand by, because some are a bit obviously critical. The Isle of Wight government have not followed their own response plan. Level 4 lockdown is only triggered once there are 21 plus cases on a 7-day rolling average. We've jumped from level 1 to level 4 overnight and still nowhere near the number of cases to trigger that point. Why?
Well, this is referring to page 26 of the Stay Safe document, if I can even say it, that's online. That document was, of course, created long before the variants came into play. We are working off our circuit breaker plan. So things did change when the variants came into play, and I think the Chief Minister did a piece of that on the press conference because they are much more transmissible. And if you followed that sort of thing, you would have a situation very quickly like Guernsey, because if you were getting with the new variants 20 community cases on a rolling basis, within days, as Guernsey found, that can be several hundred. So unfortunately, while the Stay Safe document and what appears on page 26, and I've referred to it many, many times myself in previous press conferences long ago, it's not really as relevant as it used to be with the new variants in play and the factors we now have around transmissibility of that.
Okay, and do excuse me, but the questions will jump back and forth, and you may half answer one in the way it's going to go. I'm just reading them in the order. Can you ask why we continue to do the second dose of the vaccine, which gives marginal additional immunity? These can be used to give substantial additional immunity to hundreds of people if that was done, and rearranging the appointment.
Right, the vaccine is a 2-dose vaccine. You can't just deliver a first dose and leave it. There has never been any studies what happens. Does efficacy wear off eventually? The study that people are constantly referring to, which is the preprint report that appeared in the Lancet around AstraZeneca, in relation to that study, the reason that study was commissioned was to see if what the UK did by leaving the second dose for up to 12 weeks actually harmed the first dose. So it wasn't comparing different dosing regimes. It didn't do that in the report. And in fact, on page 19 of that report, it specifically says do not use the data for that purpose. What it actually was doing was purely looking at that. And what that found was if a first dose at up to 90 days rose to 76% on average efficacy. What they didn't then do was look past, say, 14 weeks to see does that remain or does it fall off a cliff. So the second dose must always be delivered to lock in, because from the trials, and also this paper doesn't contradict that, it's the second dose that locks in protection. We don't even know, for instance, still if that's permanent or we need boosters each year. That will come with time. So we do still need to deliver the second dose. The second dose recommendation now from the manufacturers is that it can be delivered any time between 4 weeks, which is 28 days, and 12 weeks. And we have taken the decision off the back of that evidence to delay the second doses up to 10 for the 10 weeks. So we will deliver the second dose 10 weeks after the first.
And what's constantly asked, you've got a freezer full of the vaccines just sitting there.
Well, actually, the vaccine is being used up. So, in fact, actually, second doses are already booked and underway in the Isle of Man. So if we actually take off those that are already booked, so people who will be vaccinated with their second dose either next week or the week after, the actual amount with our vaccination schedule of stock that we're holding is about 4 days. And because the delivery schedules don't actually run evenly, so we don't get an even supply, if we were to release any of those, there are actually days where we would have not a single vaccine on the island. So if deliveries did not turn up for any reason, we would have to start cancelling appointments. And I don't think people want that in any way, shape or form. And that would include first dose appointments as well.
Oh, and just deal with that great Manx rumour that a whole lot went to the Isle of Wight instead of to the Isle of Man.
I haven't heard that one,
right.
Paul. That's a new one to me, but it's completely and utterly false. Completely and utterly false. We are receiving exactly the delivery schedules we were expecting, and we are receiving the 0.13% of UK stock. But that's a brand new one to me.
Well, hopefully that stopped that one in its tracks.
Where that originated, but no, it's completely wrong.
Okay. Surely the current situation could have been avoided in small measures such as mask wearing and social distancing in certain places that could have been brought in once the cluster started to grow. Looking at the low-risk venues, buses seem to feature quite often, likewise schools. Would it have been so difficult to implement masks in those locations? And following on from that, will government consider that instead of instant transition from lockdown to no restrictions, would it not be prudent to keep things like mask wearing and social distancing in place for a week or two after the lockdown finishes?
Well, that may well be the case, Paul. We may well take a transitioned approach. People will remember in the longer lockdown last year, where it was 12 weeks, we did exactly that. We transitioned very slowly through the phases, releasing things. That might be the case this time. In January, we could release quite quickly. I'm not going to prejudge what's going to happen this time. In relation to mask wearing, that does have a role, and the science around that has continued to evolve over the last 12 months. So does social distancing, but they're not ironclad measures. Hygiene, hand hygiene, etc., is still the most important thing. You can have people who, if you don't take your mask off correctly, you don't put it on, it can transmit from the mask. If you've got it, you can transmit it by leaving it on a surface. Although, again, the scientific debate is how long does a virus stay on surfaces is disputed. But there are other ways of transmission. So while social distancing and mask wearing reduces transmission, potentially, from the studies that have been found, we've got to be very careful about trying to hold things up as being the panacea to all ills. If you've got people who are asymptomatic, they may well, in other settings, transmit the virus. And this is what appears to happen with unexplained cases. We think there's asymptomatic people in the middle, and while mask wearing and social distancing may actually help, I think it's a bit of a stretch of the imagination to say that would have prevented this, because there's lots of countries that have been doing mask wearing and social distancing for over 12 months now, and have still been seeing peaks in cases, drop-offs in cases, and then secondary peaks. And they've been doing social distancing and mask wearing continuously without any release of restrictions.
Sure, but all the shops have now brought in their one-way systems and social distancing, etc. I mean, and mask wearing where they can. I mean, you agree that's something to do?
Yeah, it's a great mitigation. It's a great mitigation tool, and it does mitigate. But what I'm saying is we've just got to be very careful about trying to hold it up as a panacea and saying, well, if that was in place, then we wouldn't have a problem. Because I think if you look at most countries in the world, particularly those that introduced mask wearing and social distancing early, I think you will find that they do still have problems.
So for most children of non-key workers, there's no school for at least 6 weeks. That's after the Easter break. Obviously, this is not your department directly, but anyway, are you working on a plan to open up the 3 weeks where there would be the half term, as that would now be pointless?
Yeah, I don't believe that is the plan at the moment being considered by education. Closing any form of schools has to be taken seriously because children's education is very, very important. And we know from studies that have been taken that, shutting a school down, even with home learning, isn't the same as someone learning in the classroom. On the island, overall, when you compare ourselves to other countries, our children have received more education than most others during this pandemic period. Over the last 12 months, we have been exceptionally lucky that for the majority of the time, although admittedly with breaks such as this, our children have been able to continue their education as normal. We're hopeful, obviously, that if we can get this under control, we can return schools as quickly as possible, because I know certainly Dr. Allinson, as Minister for Education, fully recognises how important a child's education is. But again, we just need to be very careful with the schools and make sure that we don't do something that makes the situation worse.